Cardiovascular disease is the #1 killer right now of Americans. So that's both in males and females. And so that's looking at about 1 out of every 4 deaths is from cardiovascular disease. So that's about 600,000 deaths every year that people die from cardiovascular disease. Heart disease and high blood pressure are both very tricky diseases because there are often no signs and symptoms. So we call them the silent killers. If somebody is having signs and symptoms, typically they're very subtle. So headaches, nosebleeds, some spells of dizziness. As disease progresses, you can get chest pain, shortness of breath, you can get some changes in your vision. But that's why it's so important that we participate in screenings. So we recommend that every 2 years people are screened for blood pressure, and that might be more frequent if you have more risk factors. As far as cholesterol, we recommend about every 5 years or so, and that again depends on your risk factors that might be more frequent. The great thing about cardiovascular disease is that there are a lot of things that we can do personally to help decrease our risk. So specifically, if you have high blood pressure, you want to make sure that you're being followed by a primary care provider. We know a lot of people are undertreated, so ideally you want your numbers to be on the top, you want it to be less than 140, on the bottom you want it to be less than 90. So getting a blood pressure home cuff is a great way to make sure that you're at goal. Weight loss is huge. We shoot for about 1 to 2 pounds weight loss per week. We do know that 80% of Americans right now are either considered to be overweight or obese, so this is a lot of our population. Smoking, if you smoke, there's a lot of great resources out there now. We have a lot of medications, a lot of different counseling and support groups that can help. And then of course, being more active. So if you have ever been diagnosed with any high blood pressure, cardiovascular disease, or if you feel you have any cardiovascular risk factors, it's really important that you know your numbers and that you follow up with a healthcare provider. These things are very preventable. Modifiable risk factors will really improve your chances of cardiovascular health and help you to live a healthier life.